So now I will begin the presentation. So there is an introduction on Lanka hospitals. We proceed towards delivering the excellence and dependable healthcare. The hospital employs a multi-pronged strategy aimed at realizing on four best pillars: best medical care, best customer care, process enhancements across functions, and affordability, aimed at accelerated our journey towards becoming a hospital and a corporate which is truly world-class. So we have, these are the services at Lanka hospitals with a minimal wait time and dedicated unit that has the services of specialists, well-experienced doctors and surgeons 24 hours on call, 7 days of the week. Lanka Hospital is possibly the best place, best choice for treatment in a medical emergency. We have the Heart Center. Our Heart Center is dedicated to offering the most comprehensive cardiac and cardiothoracic surgical procedures. We have proven track record of excellent results and unmatched aftercare alongside the added benefit of affordability. The Fertility Center, our Fertility Center has made the miracle of parenthood a reality for couples that had lost hope of ever creating a bundle of joy in their arms. We maintain the international standards rating of 42% success rate with regard to IVF and ICSI treatments. We have also performed the highest number of IVF cases in Sri Lanka. This slide will also show you our other specialties and treatments along with kidney transplant surgery, and Lanka Hospitals has also performed the highest number of cases in kidney transplant, almost reaching 700. Our wards are designed to make your stay at Lanka Hospital as comfortable as possible with all luxuries you enjoy at home. There are different room types of categories. We have Super Deluxe, Orchid Suites, Premium Rooms, which are all equipped with air conditioning, television, telephone, and attached toilet, including attendant sofa and a refrigerator. We also have the Royal Suites. As the name suggests, the Royal Suite comes with luxury of royalty. The patients also have the additional benefit of a visitor's room with a sofa and attached toilet facility for visitors. Lanka Hospitals is a JCI accredited world-class healthcare facility and is the only hospital in Asia and Asia Pacific Rim to receive the world-class Global Performance Excellence Award. Its service philosophy is built on precepts of commitment to clinical protocols, provisions of compassionate care and services, excellence, and transcends the controversial healthcare offer. What is JCIA? Through international accreditation, consultation, publications, and education program, JCI extends the Joint Commission's mission worldwide by helping to improve the quality of patient care by assisting international healthcare organization, public agency, health ministries, and others to evaluate, improve, demonstrate the quality of patient care and enhance patient safety in more than 400 facilities around the world are now JCI accredited, and the number is still expected to grow. International hospitals may seek accreditation to demonstrate quality, and JCI accreditation may be considered a seal of approval by medical travelers from mainly the Western countries. This slide will show you the basic process of the JCI certification. Since reputation matters significantly, in medical tourism, healthcare facilities, especially tertiary hospital that seek more business from medical tourists, have sought international accreditation. The figure on this slide shows the timeline to the accreditation that it may, in many cases, takes more than 2 years to complete. So Lanka Hospital too started this process 2 years ago. Hospitals should begin by getting acquainted with the JCI standards across all areas of hospital services. These standards generally apply to management and the governing body, emergency services, medical surgical services, critical care operating suite, day surgery, anesthetic services, radiology, pathology, medical record, nursing services, central, sterilizing service, pharmacy, food service, housekeeping service, linen, environmental service, engineering service, other general administrative concerns. All the major costs, including engineering and construction costs to upgrade facilities and acquire equipment, usually are incurred in the run-up for accreditation. If accreditation is successful, it is valid for 3 years. Renewal of accreditation starts another reapplication process, possibly under a revised set of standards which are continually upgraded by JCI. So when foreigners travel to another country, they look into the following reasons. Other than for the JCI accreditation, low cost, availability, quality, medical tourism is often as much about the tourists or the medicine. For those undergoing major surgeries, there is no better place to recover than a bungalow with a view of the beach, receiving physical therapy or a massage. So similarly, for families accompanying a patient, a week at the beach or a shopping spree can clear a lot of stress following a surgery. South Africa offers safari medical tourist packages, where a family visits treatment followed by a wildlife safari. Individual hospitals will often be associated with travel agents that will arrange all manner of getaways following an operation. Why we see Lanka hospitals as a main driver for medical tourism is because it's JCIA accredited, multi-specialty tertiary care hospital. We have the most advanced and technological clinical care available, highly skilled and trained medical staff, and overseas trained consultants. So this slide we will be talking about medical tourism versus wellness tourism. There is a general consensus on the definition of medical tourism. Some definitions are broad. For example, Deloitte 2008 defines medical tourism as the act of traveling to another country to seek specialized or environmental medical care, well-being and reputation. Such a definition may be interpreted as including travel that seeks to enhance personal health and well-being, including through authentic and location-based therapies. The latter, known as wellness tourism, is sometimes included in broad definition of the medical tourism industry, thus some studies as much narrow, considering only travel for purpose of receiving treatment for a disease, alignment or medical procedure. This figure represents the ecosystem of the medical tourism industry and the important role that facilitators play in it. Communication improvement through the internet and the growth of medical facilitators prerequisites information on a hospital care, country and cost. can now be found on the internet, making international coordination between hospitals, physicians, and patients less intimidating for consumers. With the advance of medical tourism came to growth of medical facilitators that helps package medical care along with travel and pre- and post-procedure recuperation and well as tourist activities, thus making the medical tourism experience even more convenient. Various health test results can be communicated over email, such as physicians know the risk and success prospects of a medical procedure before the foreign patient arrives. The patient can communicate directly with a physician before travel and thus can develop confidence earlier on. Medical facilitators adapt that matching the need of patients and the capacity, hospitals and physicians help streamline the search process. Regardless of these ballpark figures of the size of global medical tourism, a general sense is that the medical and wellness tourism market is large, ranging anywhere between 60,000 to 50 million medical travelers based on various studies, which an approximate market size of 60,000 US dollars, 60 billion US dollars. Moreover, for reasons that are discussed in subsequent section, another commonly accepted notion is that medical tourism is a growing market. This general sense has been sufficient for many countries from Latin America to Asia to Africa to seriously consider joining medical tourism bandwagon as seek to upgrade their health sector capacity not only as a part of their economic development strategy, but also to be able to attract a share of the global medical tourism market. So, conclusion on medical tourism, the world population is aging and becoming more affluent at a rate that surpasses the availability of quality healthcare resources. In addition, out-of-pocket medical costs of critical and elective procedures continue to rise, while nations offering universal care are faced with ever-increasing resource burdens. These drivers are forcing patients to pursue cross-border healthcare options, either to save money or to avoid long waiting time. So, nationality analysis of Lanka hospitals, international patients. This represents a histogram, the number of patients we had between May and October 2014 in a decreasing order, stratified by nationality. The curve represents the cumulative percentage on the right scale. This shows that out of the total patient population, excluding Maldives, 40% of the patients are Indians and Chinese. Lanka Hospital serves patients who seek for necessary medical attention or elective medical attention, or expatriates and tourists visiting during emergency or elective procedures. Lanka Hospital, we communicate the world about our facility through social media, which we actually started up recently. These social media are computer-mediated tools that allow people to create, share, or exchange information, ideas, and pictures, videos in virtual communities and networks. Facebook, YouTube, WordPress, Twitter, and the World Wide Web are the main social media tools, and we are currently on social media. You can find us on Facebook, see our latest updates, patient testimonials, and articles. You can also like our page. Thank you.
Yeah. Thank you, Ms. Tehani Samarasekara. and the team from Apollo, Lanka Hospitals, and they have gone into innovative things such as YouTube and all that. Is very rare today. Compared to hospitals advertising in YouTube in Sri Lanka, and that's, I think, Lakit Piris also must be mentioned here. We've done a good job at Apollo, Lanka.